Good morning and welcome to another episode of Roll Call, TTSH Nursing's very own podcast brought to you by the Centre for Asian Nursing Studies, or CANS for short. I'm Kim and I will be your host for today's episode. So today we'll be learning more about the TTSH Nurse Mini Residencies headed by Sister Jamie, Sister Irene and Prof Tham. The program consists of team-based learning, simulation and OSCEs, also known as Objective Structured Clinical Examinations, that aims to promote nursing clinical competency and patient safety here at TTSH. So join me in welcoming an absolute power duo, the legends themselves, Prof Tham and Sister Jamie to Roll Call.
Hello.
Hello. Thank you so much for joining me today. Before we begin, could you just share more about yourselves with our viewers?
Thanks for having us. Okay, so I was just telling Kimberley I do not need to introduce when I was in Tan Tock Seng. I think a lot of people know me.
Already.
Too long. Yeah, I'm probably kind of like an old bird in Tan Tock Seng. So I will just introduce very casually. I was just trying to recall if someone is going to ask me this question, right? I think I will quote my better half. He once tells me, Jamie is very hard to read. It's much easier to read a newspaper from the beginning to the end, including the advertisement and the obituary. And that's how he described me. Yeah, that face.
okay.
I gave him that face. But then he was telling me, no, think about it positively. I'm describing a very colorful character. You are both serious and you can be political, you can be entertaining. Yeah, so I like it. So I didn't punish him that day.
Oh, nice introduction.
Thank you.
Thank you so much. Prof.
Thank you. So good morning, everybody. I'm Dr. Tham, Senior Consultant from the Emergency Department of Tan Tock Seng. And I think a lot of you would know that I've held various education positions, but that's not what the introduction is about. I want to tell you how I started in my career as a doctor. And honestly, if not for the hundreds of nurses who helped me along the way, I will not be who I am today. So to start with, my first posting was in obstetrics and gynecology. On the first day of my work as a house officer, I don't know how to write a prescription. I have no idea what a ward round is all about. And the word changes doesn't mean anything beyond the superficial meaning. It really was all the nurses who taught me how to write my first prescription, how to behave and prepare for a ward round, what kind of facial expression to show and not to show when the consultant scolded me, as well as, all those little things that house officers were expected to do, but nobody actually taught me until I started work. And then the other thing that I will never forget is the Tan Tock Seng old medical ICU, remember, at
Yes.
level 1. The nursing officers and the nurses there, they were the first one who taught me how to read and interpret ECGs properly. So I'm involved in this nurse mini residencies in a way to say thank you to the many hundreds and thousands of nurses who have helped me, but I never had a chance to say a personal thank you except for that moment in time.
Wow.
Inspirational.
Two fantastic introductions. I don't know how anyone's going to be able to top that in the future. But thank you so much for sharing. And I think those introductions really help to set the stage for your heart. And I think the next question also, and later on when we'll be sharing more about what inspired the program to start as well. Okay, so could you then now share more about what this Nurse Mini Residencies?
It's correct, it's
Nurse
Missy.
Nurse Mini Residencies is all about.
I would have to direct this question to Prof Tham.
Okay.
I think over the years, there is no doubt that everybody realizes our patient profile has changed. Our patients, compared to the rest of the other hospitals in Singapore, they are older. And our statistics show that they are 10 years older. That's a lot of years. 10 years older also means that most of our patients come with not just one acute problem. Usually it is a combination of 2, sometimes even 3 acute problems on top of their other chronic problems. And with their higher older age, more problems, the clinical manifestations actually can become very different.
And complex.
Complex, yeah. The impact on nurses and junior doctors is actually very immediate. Whatever they might have learned in nursing school and medical school sometimes doesn't quite prepare them for the reality of working with this group of older and more complex patients. So that is one of the things. When the ground level colleagues cannot recognize, they cannot recognize the acute manifestation when the patient turns bad. They cannot recognize that this is the way that the older generation express their pain, their discomfort, their distress. Okay, and together with the older population, the reality also is that dementia becomes more and more. And so when you have an older patient, more complex medical problems, and a bit of dementia, the usual information gathering techniques that we have becomes not quite adequate. And so patient safety in terms of adverse events starts beginning to appear, and it's nobody's fault. Next, of course, the reality also is that we do have a lot of nurses who are not born or trained in Singapore. So we are talking about language and cultural barrier. In their countries, they are most likely to be working with a much younger population. So in their nursing school training and early career training, they are not prepared for the older and more complex patients that we have. So again, we are talking about the reality where baselines are different. So that these factors come together for us to realize that we should do something very proactive and preemptive to prepare our colleagues with a higher baseline, a different baseline, a more nuanced baseline, in order to be able to cope with this group of patients who will only get older and have more complex problems.
Sister Jamie, would you want to add anything?
I suppose just to summarize this very huge, this piece of work and why do we do it, right? I think from my own perspective, with the privilege of being sent for the APN course many years ago and being the first APN in Tan Tock Seng, I do see the transition of like how medicine has been becoming more and more complex, and the knowledge that I would say the turnover, and you can't download that information quick enough. And you know, for me, I always believe that doing is learning, and you know, we always talk about this lifelong learning and this buzzword, right? But I think it is hard taking into consideration the complexity of healthcare now. Nurses that, like what Prof said, not speaking learning the culture in Tan Tock Seng or in Singapore is already difficult. The enculturation, you know, getting used to the different languages and how fast-paced we are. So I think we need to provide them with not just the environment, but it's also to provide them with the knowledge that is upkeeping or in keeping with the fast-paced changing of the population. So I think it's timely to, in summary, train the first responder. We are the first responder. Nurses are always on the ground, like it or not, 24/7.
Correct. Earlier, I shared very, very briefly that, you know, part of the mini residencies is that there's things like simulations, team-based learning, OSCEs. Do you want to share a bit more about that and what to expect from this program?
By the way, I need to have a side conversation. You know how I convinced Jamie to come on board was just with one kopi. Okay, but of course, you know, when Jamie came on board already, I needed to make sure that I feed her alcohol, grow food, before, you know, we can roll the whole thing out.
Never answer her call when she said, "Hey, let's have kopi." Think 2 times, 3 times, 4 times.
Okay, anyway, I think to me it was pretty clear that we are working with nurses where some of them have considerable clinical experience. And therefore, taking a step back to ask, what can we value add so that everybody's baseline truly moves upwards steadily over a period of time? I think identifying the gaps, and then from the education toolkit that we have, pulling out the right tools to make it fun. And this is something that our team in planning, we have said, that learning must be fun. If they come into a session, whether it's team-based learning or simulation, and even OSCE, and they don't feel the fun, the engagement goes down, and it would be just, okay, this is just something that I need to complete. I've done it, tick the box, walk off. The knowledge doesn't stick. The skills will not be replicated at the workplace, which is what we really want to achieve, you see.
Yep.
So in the planning, I still work with Lee Kong Chian School of Medicine. Team-based learning is the way for people to get cognitive knowledge in, and then be able to talk about it and share with their teammates. So we use team-based learning. There is equal personal responsibility and team responsibility. And teamwork is a big part of our work in healthcare.
Don't forget our icebreaker.
That's right.
It was
And
fun.
it was very important to have the icebreaker because she was... Okay, Jamie is very good for icebreaker. This is my encyclopedia person for icebreaker. So the icebreaking part was the fun part. And then the more serious part that still emphasized teamwork was the team-based learning. And the team-based learning makes sure that our nurse learners have gotten the cognitive knowledge into their head. So for example, the latest mini residency number 3 was about the acutely deteriorating patient. So getting them to recognize, in how to take a history or gather information for chest pain, recognize an ECG that is life-threatening. So all these came out through the team-based learning. Cognitively heavy, but a fun way to learn. Then the next fun thing that, again, this is where I need to sell a bit koyok. Digital learning team of LKC Medicine really has come in very strongly. With OpenAI becoming available and accessible in 2023, the team at LKC Medicine was able to build a conversation chatbot. And this chatbot is not the kind that where you type in your text and then it pushes out information to you. This chatbot talks.
Communication.
So we built up the chatbot with different scenarios. The chatbot will have one version role-playing as the patient or next of kin, okay? And then the second version in the same scenario package that is the assessor, which could be an APN kind of a persona. So the nurse learner had a lot of fun because the first thing they need to do after logging in is to click on the patient scenario. And the latest, for example, they talked to Mr. Tony Sim, who has been admitted for an infection, and then in the middle of it all developed chest pain. So the nurse learner needs to go and talk to Mr. Sim, find out a bit more about chest pain, and recognize that the ECG actually is a myocardial infarction. The nurse learner will then switch to now start talking to the assessor. And the conversation, of course, will be different because when we're talking to patient, it is patient-facing kind of communication skills. When we're talking to an assessor, it's almost like a mini Viva, the way we bring in the technical language, explaining the ECG and answering the assessor's questions. So the chatbot allows the nurse learner to keep trying and trying and trying. And the beautiful thing is, of course, it's on demand. That means anytime it is on the phone, they can just click on it and practice. And after every scenario, the chatbot will then grade the learner. So the learner knows, okay, did I make the diagnosis correctly, interpreted the ECG correctly? Is this the correct way to gather information from Mr. Tony Sim? Or is this the correct way to answer the questions from the assessor? So there's a lot of self-directed learning, and because the feedback is immediate from the chatbot to the nurse learner, I think it is one of those winning and highlight features in our journey together. Then finally, the most scary thing for the nurse learner was being brought together, and we keep using the word OSCE. Of course, it stands for, like we explained, objective structured clinical examination. And I believe most of our learners would not have gone through an OSCE like this, which is in real life, high tension, very high stake. But we made it easier by giving them the chance to work in a group of 6 so that, they the camaraderie continues with them into each of the scenario. And we always debrief after they've gone through all the 6 scenarios. So educationally, we build in a lot of self-directed learning, team-based, and therefore peer learning and teaching. And I thought one of the most beautiful things that we were talking about during the third mini residency that just concluded, and it was literally the assessors, many of whom are the nurse educators as well as the APNs themselves. They could literally see in the previous scenario where the hot seat learner didn't do certain thing, and then at the end of that scenario when the assessor did the debrief, the next person in the same team in the next scenario did exactly those things that were talked about and debriefed. That level of quick learning,
Instant.
and bringing on board what is good practice, I think is very heartwarming and really, really encouraging.
Anyway, to add on is open book. So we wanted to make sure the OSCE, or I would call FOSCE because it's formative, to be an open book. So psychological safety, and they have their own peers with them because it's not a one-to-one assessment. Rather, you are in the hot seat with your peer supporting you. And you know, the score is important. I mean, it's to see how you are performing, but I think they do enjoy, and I think a little bit of pressure is needed lah. Yeah, learning without pressure.
Constructive stress.
Exactly. I think it's actually productive struggle. I always love this word, right? When you struggle, there are productivity, and that's important in this whole setup. Yeah. So a lot of thoughts are put into the design of the program and how we run the program. Yeah. And then of course, we always start with breakfast.
Oh, ooh, yes.
Sponsored by Prof Tham.
Yes.
Yeah. So there's breakfast, and then we break for tea. Yeah. And then there's mingling. So I think it is the intention is really to make the whole learning fun. Yeah, fun.
I've had the honor and privilege
Yes.
of sitting
Thanks
in
for
also because I was invited, and it was very, very interesting experience because my last experience doing like simulations, there were simulated patients as well, OSCEs and all that, was when I was in university. So bringing it back, and of course, I think the first few runs of the program have been with all our nurse officers first, right? So seeing like our sisters being put in that same kind of environment that I was like, it was a very, very fun experience. And I felt like
seeing them being tortured.
yeah, and like, you know, it was kind of like Squid Game, right? Where, you know, I felt like I was a VIP because there are those rooms at the back where you can listen in.
Yes.
Then it's like those one-way
The one-way
mirrors
mirrors,
and all
that's
that,
right,
right?
yes.
So I was listening and watching, right? I was like, oh my gosh, I feel like those VIPs in Squid Game.
Oh, the one with the mask.
Yeah, well, okay, but obviously not so scary lah, huh? But I was like watching, right? But at the same time, like what you said, you know, it started off with like breakfast. You could tell like the mood was up. Everyone was very supportive of each other. Everyone knows that we are collectively going to go through this like slightly stressful program. So and seeing them also be in those situations and how everyone kind of like, you know, after the debrief, then everyone's encouraging each other and all that as well. It was it was a very nice experience, even though it was very, very stressful. So of course, like what you mentioned, and everything that you just shared, right? A lot of thought and a lot of intention was put behind creating this program. How was your planning and preparation process like? I know it started with a coffee.
A lot more food.
A lot.
And a lot more food and
a lot of stress. I mean,
yeah.
I'm blessed with a core team.
Yeah.
Well, by volunteer basis, and some is I arrowed, of course, but they came in willingly, knowing obviously the purpose. Yeah, and I think there are many hidden agendas. I think the APNs and their NE, sometimes they don't cross paths in their day-to-day, but when we are doing this planning and the whole program rolls out, you can see that they got to know each other much better. Yeah, and so I just to answer your question, the preparation phase was a lot of meetings. Back end, there's a lot of sweat, blood, literally, because there were a lot of last minute cancellation of like venues and you know the SimTech at ED.
Yes.
So we couldn't use that, and so plans has to be changed. So we need to be very adaptable in that sense lah. Yeah, and we do have help, obviously from more than just nurses. We have technicians from the SimTech, which I can't thank them enough, and my super exec assistant who are the heroes actually behind a lot of the logistics. So can't thank them enough. It's a whole kampong spirit.
Of course. Yeah. So on top of, you know, like the core team and being a participant, which we will touch on later, how about the facilitators of the program? Who are the facilitators and what was their training or preparation process like for them?
Okay, I think Prof will touch on the faculty development part.
Okay.
I think majority of the facilitators are APNs. And obviously the item writers, the people behind writing up the scenarios, the single best answer, they were the APNs because they do have the context and the expert knowledge. But having said that, they also have little apprentice. So the NEs are also endeavor to write questions, and which is very heartwarming. And this is what really I wanted to see, you know, the partnership between the different sort of groups of nurses coming together. And then we do have nurse clinician specialists who also came in to be the examiners. And they can be examiners, partner with a experienced APN. So you can see there are a lot of good things happening behind the scene.
I think it was wonderful to see, like Jamie has said, the different groups of nurses coming together and everybody aligned to the one common purpose. The APNs, of course, for all the 3 mini residency, they have the technical, the content knowledge. So they did a lot of the background lifting as far as writing the scenarios for the chatbot, for ski as well. And I'm very grateful. And of course, as well as putting together the e-learning package, that goes up to our e-learn, and the MCQs that are part of the e-learning package plus the team-based learning. So I'm very, very grateful to the APNs who came forward on their own time, really out of a passion and a belief that this is the right thing for us to do together and put all that content together. Then the next big burden they bore is actually being in the room as the assessor for the hot seat learner. So the great thing, of course, is that a lot of the APNs are already very in tune into what is good assessment practice, how to give feedback. So I practically don't have any major issue, convincing them.
Just have hand-holding.
Very, very little, if any, hand-holding at all. And they've done a wonderful job. To see them as assessor, the first part, really assessing, and then switch to become a feedback provider, the very encouraging, very nurturing attitude. I think that's great. And alongside with them, like Jamie has pointed out, the nurse educators came in to also learn how to assess. The specialist nurse clinicians in their area of specialty, like for example, the geriatric specialist nurse clinicians, they came in also to be co-assessors. Our grand vision is that the mini residencies will be owned by Nursing Education Department together with the content experts providing the background support for context, because the next thing we want to roll out is actually the nurse residency.
Akan datang.
Yep, and we hope to have another podcast sometime in the future to talk more about it.
You can invite Irene the next time.
That's right,
Okay. So thank you so much for sharing. Everything sounds very, very exciting. And I think briefly you mentioned about the nurse residencies as well, right? So currently the program, when I went, earlier I mentioned that it was all mostly the NOs. In the future, it will be rolled out to the nurses, right? On the ground as well.
More food is being planned.
Okay, so
beyond just coffee, so that we can. We have always known that the next big challenge that we need to be able to manage is how do we roll this out to the 3,000 something registered nurses in all our wards. Yes.
Better have that food budget.
The burden, but I think the burden are spread. It is not just on me. I have a very capable team. So I am hopeful that we will have enough help and support. Because it's a long haul. It's not a 100-meter dash. It's a marathon, maybe ultra. Require me to swim through water, because I think it's exciting. This is relatively new. Even though I have run many OSCE, the OSCE is very, very different. And the component of having e-learned, team-based learning, and then the chatbot. So many permutations, right? So I would say it's one of the hardest program I've run, but it's also one of the most fun program that I've run and most meaningful.
So I'm so glad that, as a organizing team, and to see all your hard work and prep, like months or years, hard work as well.
Thankfully, months.
Okay, months of hard work being poured out into such a program. And after that, I can't imagine how fulfilling it must be to, after, and you were mentioning earlier also that the graduation for the first batch will be actually next week.
That's right.
By the time the podcast launch, it will have been done already and over. But to see from the start to end, it must be so, the feeling must be so
Yes.
Yes.
Is to celebrate their milestone, right?
Yes.
So if
Yeah.
you see any of them around, congratulate them. You know, it's been, I'm sure, a very tough journey for them, but I'm sure it's very, very enriching. So encourage the second class 2025-02
That's right. Yeah.
in August. You know, you're coming on board. You know, join us. Learning is fun.
Yeah. Okay, so before we end, I have one last question. What can we continue to look forward to for this program?
My boss.
Okay.
The mini residency is really meant for all the registered nurses, starting with the wards in Tan Tock Seng.
Yep.
So currently our plan, like I said, with more food, is about how can we roll this out and maintain the quality of learning for every learner that comes on board. And of course, it's not a small thing.
Yeah.
After all, we're talking about more than 3,000 registered nurses in Tan Tock Seng. But I believe we can do it. And like Jamie has said, this is not a 100-meter dash.
Yeah.
This is a marathon. And so pacing it out,
Yep.
okay, having the opportunity to always get a feedback, review until we get to a very good, steady platform, baseline, and we know that this is what works. So part of the excitement, of course, is looking at the first 36 nursing officers with us.
Yep.
You can see that some of them are very inspired. Yeah. They responded to us when we said, come join us.
Yep.
Because in order for us to make this real for more than 3,000 RNs in Tan Tock Seng, we need to bring on board some of our first few generation of learners.
Yep.
And you can see that they buy into the idea. They want to be a part of this because it's something meaningful. So we welcome them on board.
Please join us. 小狗友.
And I do believe that we will reach a crystallization point
Yep.
where the ownership is so big among the RNs, the nursing officers as well, that this program will almost take on a life of its own, you know, with support from nursing education. Yeah. So this is the mini residency. And then Jamie and I, of course, will have several more sessions of coffee and food and start planning.
Must elevate to Michelin star.
Oh.
Okay, in my July bonus is big. We'll talk about Michelin star restaurant. Okay, so the next thing, of course, is nurse residency.
Yeah.
Because that's the other part that's very structured,
Yeah.
and we need the mini residency to roll out first in order to create a very good baseline for us to then launch the residency,
Yeah.
which will be a bit more aligned to the doctor's residency that's been running in Singapore for the last 15 years.
Very cool. Very cool and exciting stuff. And once again, thank you so much for joining me today. It's been an honor to, you know, not only experience what it's like for the participants, but then now to hear all the behind the scenes things. Very easy.
Mind blowing.
I always end up saluting my guests. I don't know for some reason. But thank you so much.
Thank you, thank you.
Of course,
Thank
thank
you.
you. Like, and I think
Thank
all the
you.
more this shows how holistic this program has to be. You know, like not just all the so much focus on the clinical side, but I think this also helps like us. Maybe like a side effect of it is to even strengthen the nursing community and the bonds, the shared trauma, shared stress. You know, through the program and these shared experiences. Really hard to form all these kind of core memories for us also.
Yes.
So thank you so much once again.
Thanks for
It's
having
been,
us.
of
Yep,
course,
Thank
my
you very much
pleasure.
for having
It's
us.
my pleasure.
Thank you.
Thank
Yeah.
you. And with that, sadly, we've come to the end of this episode of Roll Call. Thank you so much for joining us. Remember, you can also check out this episode on Spotify at Nurses of TTSH and find us on Instagram and TikTok at Nurses of TTSH as well. It's been Kim with you, and we'll catch you in the next Roll Call. Bye-bye.
Bye.